I'm Sean Bartholomew. I'm one of the biopharma applications engineers at GermFree.
I'm Stephen Ondek. I am the commercial director of facility sales.
We're here at Phacilitate, bringing a group of a variety of industry professionals together to talk about how we can start delivering some of these therapies at clinical centers. The symposium is all about how we as an industry can work together to bring cell therapy production to blood centers.
Key takeaways that we're looking to get out of this symposium is really bringing the entire industry together. We're trying to find the best way that we can position clinical sites and cell and gene therapies and coming up with a true full solution. Not only just having a manufacturing site, but a site that can really do blood draws, is going to collect the material, is going to be able to manufacture the material, get it back into patient, and hopefully save that patient's life. So that's what we're really hoping to get out of the symposium in general, is just trying to bring everybody together to get on that same page. Often we see a lot of people in our industry where it's very bucketed, and I focus on just this, I focus on that. We're trying to find a total solution for cell and gene therapies, and it really often starts at the clinical site. I always think us as one of the thought leaders here for Advanced Therapies Week, not only in the facilities that we're making, but also in the relationships that we're building, how we're helping drive the industry to a decentralized approach, and how we're supporting on that front. I think we're really hoping and continuing to drive as best we can solutions for our customers, but also bringing the industry along to that next phase. And where do we see it growing? We think a decentralized manufacturing approach is going to be that. So that's what we're here to support on, and that's what we're hoping to see and continue to grow as we move forward.
It's important not only to understand where we are now, but getting some of those clear expectations to not only the industry, but the patient representative groups, and knowing that, or letting them know that there are other solutions available and they're on the way, and that we as an industry are committed to delivering those medicines to the patients.